We know that over 40,000 people are in work across Hull and East Yorkshire who are experiencing problems with their mental health, which is going to have an adverse effect on their employment. The majority of these people are going to be unable to access the essential support and advice that they need to stay well in work and retain the employment that they're in. Because we know that currently there are no services like this available in the local area. We feel that we've identified a significant gap in local provision, and one that if it's left unaddressed, we will continue to have a wider effect across our local communities. Graham is one of the many people who we've been in touch with who has been experiencing problems at work because of his mental health difficulties.
But when I was at work, I would try my best to do things, but the concentration was lapping a bit. Kept not so much on timekeeping, but I was just a bit lapsy, making the odd mistake here, making the odd mistake there, but the little mistakes sometimes can turn into big mistakes. Mm-hmm. And then I thought to myself, if I tell one of my workmates, what's going to be what's going to be the reaction? Mm-hmm. What's going to be the reaction from myself if they don't understand what I've just gone and told them, because I've let the cat out the bag.
Right.
I don't know if they would have been understanding enough, because everybody says, oh yeah, everyone has a story to tell, everybody has a problem. But when you've got a mental health problem, it's a little bit harder, because you're trying to recognise. I was a little bit in denial anyway, because I thought my wife, I didn't tell nobody. Things was happening at home, I was getting more ratty, and just things what I did differently.
And what about your managers? Could you speak to them?
No.
And why was
because
that?
I didn't know how to go about it. In all honesty, I thought I've got myself into this. I'll get myself out of it. The further I tried, the harder I tried to get myself out of it, the further I dug a big hole for myself.
What do you think their response might have been if you had spoken to them?
I don't know. It would have been maybe took a bit, maybe outwardly, or maybe I don't know, because I never got to that stage. And even at this stage now, I don't think managers are aware that I went to take my life. Mm-hmm. But when I came off work, never been out of work, and you get past that stage of watching television and reading books. There's only so much TV and reading books you can do. As my wife went to work, you're on your own, so you sat thinking and thinking. Mm-hmm. None of it's positive. Mm-hmm. It's all negative. And even now to this day, I still question myself, will I ever return back to work? I don't know, I ain't got that crystal ball.
For over 3 years, we've been helping people experiencing mental health problems to access employment, volunteering and training opportunities. We've seen a lot of success with this and have been able to support over 400 people. However, feedback from people using our services and from employers has made us realise that something new is needed, namely support to help maintain employment for people already in a job. There are many people in our local area who work to help people to gain employment, and indeed we intend to continue this work, but there is currently no help available if you have a job and are struggling to keep it because of your mental health problems. We hope that by intervening early, when someone is still in employment, our support will enable people to fulfil their potential and avoid the damaging cycle of unemployment which negatively impacts on people's mental health. All in East Yorkshire Mind know that mental health and its consequences for and connection to the workplace is a matter of significant concern.
Honest data over the last 12 months has shown us that there's a substantial number of working people, that's over 10,000, who have been experiencing problems with their mental health for more than 12 months. And in our local communities, there's a prevalence of depression, anxiety and long-term mental health conditions that exceeds the national average. In this environment, barriers to communities being able to thrive can be substantial, and the adverse consequences can be felt in a much wider spectrum across demographics, including employment status, deprivation, social isolation, child poverty and homelessness.
So given that we know there's a really big need out there for people who are in work, we've got a vision to be able to help local people, and that is to work in two different ways. One is to support local people who are experiencing mental ill health within work, but also the other strand is to help local businesses to be able to improve their culture in the workplace, which means that everybody gets extra support.
Alongside this bespoke, individual level support, we will also offer employers our expertise to develop and implement the Time to Change action plan for their organisation, thus enabling them to sign the Time to Change employer pledge in order to promote a more positive environment for wellbeing for the whole workplace.
Our expertise and lots of local knowledge in this area means that we are best placed to launch this new groundbreaking approach to supporting in-work well-being and job retention, which has not been tried before in our area. We know that we'll need to continue to learn and develop this model in partnership with other local services as well as community stakeholders in order to maximise our impact and fully meet the needs of our local communities. We're really passionate about working with other people and learning about what works as we go along, and we'll work with people who use the services as well as employers, and using a shared approach to goal setting and continuous improvement, we'll make sure that all of those views inform everything that we do to ensure that the spirit of co-design that created our initial approach is continued during the life of the project.
Our vision is that no one is written out of the workplace because of their mental health problems, and so our primary outcome measure for this project will be whether those people that we work with are able to retain their employment. This may either be their original employment or a new job that we support them to secure during the course of their involvement with us. We will be able to monitor and measure this primary outcome for each individual during the course of the project.
We believe that through accessing this project, 60% of people will be able to retain the employment that they're in.
We'll also use the Recovery Star, which is a well-recognised tool, so that we can understand right at the beginning from somebody how their mental health is, and then we will measure that again at appropriate points over subsequent months, leading to a concluding assessment at the end. So it's a robust measuring tool for us to be able to understand how people have improved in their mental health over the entirety of our project. We're planning for 75% of people who to have reported an improvement in their ability to manage their mental health by the end of the work that we do with them. And also that 75% of people will have achieved their own personal goal. That's the thing that they've told us that they want to achieve the most in the support that we give them. We expect to be able to work with up to 50 people every year, and with each person we work with to be able to access up to 12 months of support. So over 3 years we'll work with up to 150 people. Based on learning from our colleagues in Leeds, we anticipate that at least 75% of people we work with will want to engage with their employer. That might be through mediation or advocacy, or it might be around time to change action planning. We'll promote our expertise to local organisations in relation to time to change action planning, even where they don't have any employees that are receiving individual support from us. That means that we'll be able to set some further targets around time to change sign-ups.
We know that there are high numbers of working age people with severe and enduring mental health issues across Hull and East Yorkshire. So what we intend to do is use the learning from this project to inform future service developments that can reach more people which would benefit from support to retain their employment. We also recognise that there were many people who have mild to moderate mental health difficulties that are seeking support, but they would not fit into the scope of this service model. We will triage all referrals within 3 working days so that people seeking support are signposted to other local services, whether delivered by ourselves or other agencies, even if the person doesn't meet the referral criteria for this project. We also have extensive experience of delivering community-based mental health support, and we know that helping people to address their problems at an early stage can be instrumental in enabling them to fulfil their wider potential.
We really strongly believe that any project has to be built on people who are going to use it so that they have an influence in how we design any project. So we've run a series of focus groups and we've listened carefully to what local people have told us about their experiences of mental health difficulties at work. They've told us that what they would value most when they're struggling with their mental health is having someone to talk to, someone who they trust and who can offer them personalised and effective coping strategies, as well as support to address concerns about things like their workload or their working conditions. We've also talked with over 20 local employers across Hull and East Yorkshire through a range of sharing exercises, including focus groups, and listened to their experiences. They've told us that improving mental wellbeing at work is a real priority for them, but many organisations struggle with the time, the knowledge and the resources in terms of actually taking meaningful action. In addition, we're part of the NHS Hull's Working Voices Forum, and that group has also confirmed support for this proposal, having conducted their own research which identifies that support for mental and emotional wellbeing is the most important health priority for local employers. Our vision and our service model have been shaped by the involvement of these local people and their experiences. People we've worked with in our pre-employment projects over the last 3 years have told us that trying to retain your job when you've an enduring mental health problem and cannot find appropriate support can be a very distressing, challenging and lonely experience.
We are committed to developing this project to ensure that local support is easily accessible for those who need it. Throughout all of our work, our teams are passionate about supporting people so that they are able to fulfil their potential. By supporting people to retain their job and thrive at work, there is also undoubtedly the potential to have a wider positive impact on the overall resilience of local communities.
Founded in 1976, Hull and East Yorkshire Mind has been supporting people with mental health issues for over 4 decades in the local area. We are an independent charity that's governed by a group of local trustees, but Hull and East Yorkshire Mind is affiliated to a national mind network which is made up of over 130 local mind associations across England and Wales. And we pride ourselves in delivering services, campaigning and giving a voice to people with mental health problems, their families, their carers and the community we serve. And our overall ethos is one of care, compassion and hope, and we are proud to have an unswerving commitment to equality in all that we do.
Everything that we do at Hull and East Yorkshire Mind is based on our model of mental health care that we call REACH. So we think that it's really important to think about relationships with everyone that we're supporting with their mental health, because relationships and really genuinely caring for the people we work with is really important, and the environment is important as well, so that somebody is receiving that support in an environment which is positive and where they feel safe and secure and valued. activity is a really core value and really important to improving your mental health. So having a form of occupation and the importance of having a role in society is something that this project will be all about. But compassion is really important too. And sometimes we're just really hard on ourselves, and at Hull and East Yorkshire Mind we know it's really important to be compassionate and have that compassionate approach through everything we do. And really importantly, hope is important as well. So hope is something that can be really difficult to find if you're struggling with your mental health. But at Hull and East Yorkshire Mind, we want to help people to find that hope and to use that hope in their recovery.
People with lived experience of mental ill health work across all areas of our organisation, from our Board of Trustees through to our much valued team of volunteers. And the principle of co-production and individualised and personalised goal setting is imbued throughout all of our therapeutic practice. In 2018, we helped over 5,000 people to manage their mental health. We deliver a range of services to our local community, from talking therapies for children, young people and adults, a substantial portfolio of supported housing provision, as well as specialist mental health expertise working alongside the emergency services. We have substantial experience in running pre-employment vocational support projects where we support unemployed and/or economically inactive people with their mental health, along with assistance with job seeking applications and interviews.
We are a people-led, strengths-based organisation which is firmly rooted in the local community of Hull and East Riding, and we are a respected, trusted partner by all of our external colleagues, and we have an ambitious vision for the future which we will not give up until everybody experiencing a mental health problem will get the respect that they deserve.
In order for us to achieve a tangible and sustained impact for individuals in the local community, we want to run this project over a 3-year period, and therefore we're seeking a total of £276,000 in order to fund this.
As a leading third sector provider of mental health services, including vocational support, we've amassed an extensive knowledge of existing services, and we regularly work in partnership with organisations from all different sectors across our community, and we've consulted with a wide range of local organisations in the development of this proposal, including NHS commissioners, large, medium and small employers across the private and voluntary sector, local agencies delivering pre-employment and vocational support.
This review of the local landscape has identified that there are numerous local agencies providing support and interventions for those people with mental health problems who may be unemployed or economically inactive. In addition, we know from our discussions with local people that some, predominantly larger companies, offer access to counselling services for their staff. However, we believe our new service will be the only local service that offers a comprehensive package of support for people with a mental health problem who want help to retain employment, as well as provide expertise to employers on organisational development.
We've a strong reputation as a trusted partner locally, and we'll build on our established networks and contacts in order to ensure that we promote this service to employees and employers across Hull and East Yorkshire. Our aim is that the whole 2019 Time to Change programme will inspire local employers to take action to support mental health and wellbeing at work, culminating in a mass Time to Change Employers Pledge signing event in October 2019. We have the project lead role for this programme, which will give us a fantastic opportunity to raise the profile around supporting positive mental health in the workplace across Hull and East Yorkshire, as well as provide an excellent forum for promoting our job retention and organisational development service.